What if I told you that healthcare in the Philippines is actually better than in the US? Better quality, faster service, and a fraction of the cost. You'd think I was crazy, right? Well, I'm about to prove it. Before I moved here, I spent months and months researching the Philippine healthcare system. And I looked at forums, YouTube, expat groups, you name it, and there was nothing but conflicting reviews, horror stories mixed in with, glowing testimonials. I didn't know what to think. I didn't know what to believe. I was really concerned about, getting sick in a developing country and wanted to do my homework. But then I actually got to experience it firsthand. And it turns out almost everything I read was completely wrong. So today, I'm breaking down the massive differences between the healthcare system in the Philippines and the healthcare system in the US. So stick with me. Hey everyone, welcome back to my channel, Mr. Wright in the Philippines. If you're new here, I'm Rick Wright, and I've been living in the Philippines for a little over 2 years now. And one of the biggest surprises, and honestly, one of the best things, and a pleasant surprise at that, about living here, has been healthcare. I know that may surprise some of you, but before I moved here, I had actually done a ton of research, and I had all these assumptions about healthcare in a developing country. I thought maybe quality would be questionable. I thought about clinics, maybe they would be dirty or outdated, and I was completely wrong. Since I've been here, I've had 2 major health situations, and the experience was so different from what I had in the US that I knew I had to make this video to help educate other, foreigners that are struggling with as well. Because if you're considering moving to the Philippines or you're already here, understanding how the healthcare system works here, what the costs are, the process, the quality, this is absolutely critical. And, at the end of this video, I'm going to cover something that, a subscriber asked for that may seem a little, morbid, but this is it. He wanted to know what happens if you die in the Philippines. What are the funeral costs? What about cremation? What about burial? And how does that compare to the death in the U.S.? Because again, that's also part of healthcare planning as well, especially as we get older. But before we get started, I want a quick note before we dive in. If you're new here, I share honest, real-life stories about, my life in the U.S. and what it's like building a life here in the Philippines and comparing the two. And if that resonates with you, then, hit that subscribe button. I post new videos every few days comparing different cultural aspects. And it is free. Some Filipinos don't know that. And I also want to give a very special thank you to my super fans for your contributions and your gifts. And if you enjoy this video, you can show your appreciation as well by hitting that thanks button in the bottom corner and leaving a gift of your own. It really does help me a lot to be able to continue creating videos like this and producing content like this for you to help educate you on the different cultural aspects. And thank you again so much for all your comments and your kind words. I really do read every comment, and I try to respond to as many as I can, and it's been overwhelming, the kindness, and so thank you so much. Now let's dive in. So let me start with my dental emergency, because this was, honestly, it was the first real test of the Philippine healthcare system that I had encountered. I had a really serious toothache. It was a Sunday night. It was pain. It was swelling. I couldn't eat. It was excruciating, but I knew I had to wait until Monday. In the US, here's exactly what would have happened. In the US, the process is, first, you gotta call your dentist, and usually the earliest appointment is gonna be 2 to 3 weeks out. If it's truly an emergency, maybe they squeeze me in a couple of days. You go to the appointment, you're gonna sit there and wait in the waiting room for probably at least an hour. Then they're gonna do x-rays, you wait again, then the dentist will look at the x-rays, he'll examine you, and they'll decide that you need to extract the tooth. But they're not gonna do it that day. So they'll schedule you for the extraction, which they consider a surgery, maybe a couple of weeks later, and then you come back for the actual extraction. You pay your out-of-pocket, which could be several $100s. I paid almost $800 out of pocket after insurance for a deep cleaning one time. And then you wait for the insurance claims, the billing, etc., and maybe you have to pay more. And the total time for all of this is about 2 to 4 weeks from the time you have the problem to it actually being resolved. The total cost with insurance is going to run you anywhere from maybe $500 to $1,500, depending on your insurance plan, your deductible, copays, etc. Total cost without insurance is going to run you maybe $2,000 to $4,000. Now, here's what actually happened to me here in the Philippines. Again, it was Monday morning. I walked into the clinic, into the dental office. I had no appointment. I just walked in. It was about 10 o'clock in the morning. I had to wait until the clinic opened. I walked up to the front desk and I said, I've got a toothache. I've got, it's really excruciating. It's painful. And they said, okay, have a seat. Within minutes, not hours, literally 5 minutes, I was in the dentist chair. The dentist examined me, they looked at the tooth, she took some x-rays right there on the spot, and she said, this tooth needs to come out today. And she said, I can do it right now if you want. I said, absolutely, I'm in excruciating pain and whatever you have to do. The entire procedure, x-rays, anesthesia, the extraction, post-care instructions, pain medication, and paying the bill took maybe 2 to 3 hours. And they were thorough. They were professional. They used modern equipment. The clinic was, spot on. I always thought it looked like a health spa. It was so clean. The dentist spoke perfect English, and she explained everything. And when it was done, I went to pay, and I'm thinking to myself, all right, here comes the shock. How much is this actually going to cost me? Because I don't have any insurance. And the total cost was less than 9,000 pesos, which is less than about $160 US. And that included the initial consultation, it included x-rays, it included the actual surgery, the extraction, which is considered oral surgery, the anesthesia, and pain medication to go home, and the follow-up visit in a week or two to remove the stitches were all included. I walked in with a problem, and I walked out 3 hours later with it solved for less than $160. No insurance, no pre-authorization, no waiting weeks for an appointment, no billing department hassles or battles or nonsense. In the US, that same procedure would have cost me, like I said, $2,000 to $4,000 without insurance. Or even, several $100s, maybe $500 to $1,500, even with insurance after you pay your deductible, your copays, etc. And it would have taken, maybe 2 to 4 weeks. All right, so now let me tell you about my other experience when I got really sick. And this was about 1.5 years ago, and I woke up one morning and I just felt horrible. Body aches, I was vomiting, I had diarrhea, fever, chills, headache, the whole 9 yards. I couldn't eat, I couldn't keep anything down. I just felt weak and miserable. And this went on for about a week. And I tried different over-the-counter medications and just nothing worked. And I realized I need to go see a doctor, and I hate going to see the doctor. And it's mostly because of my experience in the US. If this had happened in the US, here's what the process would be. Option one, I can go see my primary doctor. You have to call, make an appointment. Earliest one is going to be a couple of weeks out if you're lucky. If it's urgent, maybe I get a same day appointment, but not likely. You're still going to go there and wait, for hours. In the doctor's office, you're going to pay your copay for the visit, which is $30 to $50 depending on your insurance. Doctor's going to examine me, order blood work. Sometimes you have to go to a separate lab facility for the blood work. Sometimes they do it right there. The lab work is going to cost you anywhere from $200 to $500 depending on your insurance and what they cover. And then you're going to wait a few days, for the results. Doctor calls, with the results, says, hey, everything looks normal, but, I want to refer you to a specialist anyway. Now you've got to wait another 2 to 4 weeks for an appointment with the specialist. And then the process repeats. Or you have option two, which you could go to urgent care, which you'll have to if it's after hours, or you want to walk in. You go to the urgent care center. You're going to probably wait 2 to 4 hours to be seen, and that visit's going to cost you maybe $150 to $300 with insurance, maybe $300 to $600 without, and depending on what they do. And they're going to do the basic exam, maybe run some tests, and then likely they're going to probably say they can't really help you, and you need to go see your primary doctor or a specialist, and then you're right back to option one. Option three is you can go to the emergency room, if you're really that bad. But nobody likes to do that. You go to the emergency room, and that's your only option if it's after hours on the weekend. You're going to wait 48 hours there just in the waiting room. Then you're finally going to get seen, and this could cost you anywhere from $1,000 to $3,000 even with insurance after you pay your deductible. Maybe $3,000 to $10,000 if you don't have any insurance. They'll run their tests, and then if they can't figure it out, they're going to refer you back to your doctor or specialist, and you leave with a massive bill and still no answers. So now total time in the U.S. this is 1 to 4 weeks, and you still don't have any resolution. You're still sick. Total costs are maybe $2,000 to $5,000, and that's with good insurance. Maybe $5,000 to $15,000 without any insurance. And now I have to be clear. I lived in Miami, so this is what I paid and what I experienced. All of this could be completely different depending on where you live and what insurance plan you have. So here's what actually happened here in the Philippines. I walked into the local clinic. Again, it was morning time. I don't remember, maybe 10 o'clock. I had no appointment. And I just told the receptionist that I'm really sick, and told her what I was going through, the vomiting, the diarrhea, the fever, and she said, okay, have a seat. And within literally 5 to 10 minutes, I was in with the doctor. A wonderful Filipino doctor, spoke perfect English, very professional. She examined me, asked a bunch of questions about my symptoms, and she said, okay, let's run some tests, let's do some blood work, let's figure out what's going on. And they did it right there in the clinic. They drew the blood, they ran a complete CBC, which is a complete blood count. They checked my blood sugar level, they checked my cholesterol, they checked my my liver functioning, my kidney functionings, you name it, everything. And they ran tests for infections, white blood cell count as well. They did a urinalysis, and all of this took maybe an hour, and then they called me back in the next day, and the doctor went over all the results with me, and everything was normal. Everything, all the blood work was perfect. My sugar normal, cholesterol fine, and no infections determined. And she couldn't see anything. Liver, kidneys, everything was functioning perfectly. And as she said, I honestly don't know what is going on or what's causing this. She said, everything looks normal, all your tests are normal, but you're obviously sick. And so she decided she wanted to refer me to an infectious disease specialist to dig deeper. Because remember, this was just the clinic, and they were limited in what they could do. So after all of this, the consultation and the total cost for this entire visit, which included the doctor consultation, all the lab work and all the tests that they ran, was 8,000 pesos, which is about $145. In the US, the lab work alone would have been $500 to $1,500, and that's with insurance. Maybe $1,500 to $3,000 without insurance. And I would have waited days for the results, not just the next day. So then I went to the infectious disease specialist the next day. The doctor gave me the specialist information, and I went the next day. Again, walked in, 10 o'clock in the morning. I waited maybe 10 minutes, and that was only because the doctor was running late. The specialist, which was a highly trained infectious disease specialist, he saw me. He reviewed all of my previous test results, which I had, on paper from the previous clinic. He examined me thoroughly, asked, a lot of questions, and he said, I want to run everything again because these lab results were, already old. But he also wanted to add imaging to check my organs. So he ordered, again, the complete blood panel, all over again, and as well as an ultrasound of my stomach, an ultrasound of my liver, ultrasound of my, my pancreas, ultrasound of my kidneys, and my prostate as well. He wanted to picture all of this to see what the lab test may not pick up. And his consultation fee was 750 pesos. That's about $13.50 US dollars. And this is for a specialist, an infectious disease expert. So the next day I went to the lab and the imaging center, which happened to be in the same building, and they did all the lab work, ultrasounds right then and there. Very, very clean, professional equipment, professional staff, very friendly, all spoke perfect English, and I had the results the next day. And that was only because they had to wait for the doctor to actually read all of the ultrasound, because I was the technician takes it, but then the doctor has to read it. And the total cost for all of this, the lab and imaging test results, was less than 10,000 pesos, which is about $180 US. And in the US, a specialist consultation without insurance would have easily been $200 to $500. Specialist consultation with insurance, all right, maybe you paid $50 to $100 for your copay if you meet your deductible. And remember, in most cases, you have to still, in the US, you still have to see your primary doctor first, and then the primary doctor has to refer you to the specialist. So you're going to be paying both of them, the copays and for the visit. And all those labs and ultrasounds without insurance would have easily cost me $3,000 to $6,000. And with insurance, it still would have cost me $500 to $1,500, depending on your deductible and what your coverage you have. So let's add up all my total costs in the Philippines. All right. So first, I went to the clinic. I had the visit, ran all the blood work and all the tests, urinalysis, everything. 8,000 pesos, $145. The specialist consultation, 750 pesos. So you add in another 10,000 for the second round of lab work, and all total was less than 10,000 pesos, which is about $350. And in the end, everything came back normal, and the doctor determined I just had a nasty infection, nasty virus, gave me some antibiotics, and I was better. So now let me break down the actual comparison of the two healthcare systems so you understand why the Philippines is so different. The United States healthcare system is primarily insurance based. Most people get health insurance through their employer because they can't afford it on their own. Average monthly premium for an individual, I paid about $350 a month, but it could be more depending on your plan. And average for a family can run you anywhere from $500 to $1,000 depending on your deductible. And these premiums are before you even use any health care. You have deductibles. Your average individual deductible is going to run you anywhere from $1,500 to $5,000 per year. Mine was about $2,500, and this means you pay this amount out of pocket before the insurance company even starts to pay anything. They don't help you out at all until you've actually paid all of your deductible. And then even still, you still have the co-pays anytime you go to visit a doctor. Your out-of-pocket maximums, are going to run you anywhere from $6,000 to $9,000 for an individual, and maybe $12,000 to $18,000 for a family. And this is the most that you'll pay in a given year, supposedly. But this also doesn't include the premiums, which are in addition. So let's do the actual math for a typical American with decent employee-provided health insurance. Your monthly premiums, maybe $350 to $500 a month. Your deductible, anywhere from $1,500 to $5,000. Mine was $2,500. You have moderately bad, some prescriptions it covers, maybe an ER visit. Once you hit your deductible, $2,500, you still have additional copays and costs of maybe $1,500. So your total annual cost could still run you over $10,000, and that's with good insurance. If you don't have insurance in the US, well, that's a different story. A doctor's visit is going to run you $150 to $300. A specialist maybe $250 to $500. An ER visit may cost you $3,000 to $10,000. Hospital stay, forget it. $10,000 to $30,000 per day. And if you have a surgery, $20,000 to $100,000 easily. In the U.S., people literally go bankrupt from medical bills. In the Philippines, their healthcare system is completely different. It's cash-based mostly, where you pay as you go. You don't have monthly insurance premiums unless you choose private health insurance. You don't have any deductibles to pay. There's no co-pays. You don't need a pre-authorization from the insurance company to go see a doctor or specialist. You literally just pay for what you use when you use it. Typical costs, general doctor visit may 300 to 800 pesos, which is about $5 to $15. Specialist visit, 500 to 1,500 pesos, which is about $10 to $25. Prescription medications are going to run you maybe 50 to 500 pesos, which is about $1 to $10, and that's for most common drugs. A full blood work panel, maybe 2 to 5,000 pesos, which is $35 to $90. X-rays may run you 500 to 1,500. Ultrasound maybe 2 to 4,000, which is $35 to 75. A CT scan may run you 5 to 10,000 pesos, which is $90 to $180. MRI may run you 8 to 15,000 pesos, which is about $145 to $270. And hospital stays with a private room at a good hospital will run you maybe 3 to 8,000 pesos per day, which is about $55 to $145 per day. Semi-private will run you 1,500 to 4,000 pesos per day. And this includes, nursing care, basic monitoring, and the room. Now, if you need major procedures, like an appendectomy, for example, like my friend just had, 80 to 175,000 pesos, which is 1,400 to 2,700. Maybe a cesarean section, 100,000, 200,000 pesos, which is 1,800 to $3,600. And if you need a full-blown knee replacement, that'll run maybe 300 to 500,000 pesos, which is about 5,500 to maybe 9,000. In the U.S., these procedures, forget about it. Appendectomy is going to run you 15 to 35,000 with insurance, 3 to 8,000 dollars. A C-section is going to run you 15 to 80,000, and which is about 3,000 to 7,000. A knee replacement, 35,000 to 70,000. With insurance, maybe you pay 5 to 15,000. Now here in the Philippines, they have PhilHealth, which is Philippine National Insurance. Philippine citizens and permanent residents can get PhilHealth. You are qualified for that. And it covers part of hospitalization costs. Your monthly premiums are going to run you maybe 400 to 5,000 pesos, depending on your income and how many people are on the plan. It's not very comprehensive, but it does help with major expenses. And, most expats like me, we don't even bother with insurance because the cash prices are already so low. So it's really not necessary. All right, so now let's talk about the actual quality of care, because I know you might be thinking, okay, it's cheaper, but is it any good? What's the quality like? And here's my own honest experience. This is what I have. Maybe you had something else. The pros are that many Filipino doctors were actually trained in the U.S. or in a Western country. English is widely spoken in the medical settings, which is a huge advantage. They used modern equipment, especially in private hospitals and the clinics. And the doctors actually spent more time with me. They're not rushing just to go see the next patient. They actually spend their time with you and talk to you. You get very personal attention and care, which you don't really get in the U.S. You have access to medications that require prescriptions in the U.S., which means you have more freedom and more accessibility. Now, the cons is, yes, the quality can vary significantly between facilities and top private hospitals, like Makati Med, St. Luke's. They're excellent and they are very comparable to U.S. hospitals. However, the rural clinics or government hospitals, they can be very basic and not as clean or quality as you expect. Not all doctors are equally trained, so you have to do your research. And for very complex or rare conditions, you might need to go to Manila or even go abroad to have it handled. Emergency response, like ambulance or 911 is really not that developed, if it exists at all in your area, because not everybody has it. So my take for 95% of health issues, regular checkups, common illnesses, minor injuries, dental work, basic surgeries, the Philippines is more than adequate. And honestly, in some ways, it's actually better than the U.S. because of the accessibility, the cost, and just how much easier the process was. But for more complex surgeries, rare diseases, or cutting-edge treatments, the U.S. still has a big advantage, in terms of specialized facilities and research hospitals and things like that. But here's the thing. Even if you needed a complex surgery and you chose to fly back to the U.S. for it, excuse me, you'd still save plenty of money just by living here in the Philippines and handling all of your regular healthcare issues here. And again, now keep in mind, once again, this applies, if you're near or in a larger city. If you're out in the province somewhere, then the quality is far less and must be less convenient. It may be less convenient. It may not be near a facility. Medications. Let's talk about that. A quick note about medications is because this is really important. A lot of people use that in the U.S. Many, if not most, medications require prescriptions. Prescriptions require a doctor visit, requires lab work, which is more money. And even with insurance, drugs can still be really expensive, and insurance doesn't always cover everything. So you may be looking at $50 to $500 per month for just common medications. And yes, generic drugs, they do help, but they're still expensive. Here in the Philippines, many drugs are available over the counter, and you don't need a prescription. And yes, that includes, things like antibiotics or blood pressure medicine, or sometimes in some cases even medicines for diabetes like insulin. Now, some expats do actually opt for private health insurance here in the Philippines, especially if you've got a family. And these options include local Philippine insurance. Companies like MaxiCare, MediCard, and Pacific Cross are popular and very reputable. Annual premiums are going to run you maybe 30 to 80,000 pesos, which is about $550 to $1,500, depending on the age and the type of coverage you get. And coverage typically covers hospitalizations, some outpatients, and pre-existing conditions after a certain waiting period, which they didn't have before. There's also international insurance that's available. Companies like Cigna Global and Alliance, and it's obviously much more expensive. It will run you maybe $2,000 to $6,000 per year. But this covers Philippines and many other countries. And this is actually good if you plan to travel a lot. Now, do you actually need insurance in the Philippines? Honestly, many expats don't even bother because the cash prices are so affordable. And a lot of times we just keep an emergency fund set aside, to cover any major expenses or accidents or hospitalization or anything like that. But, if you don't have an emergency fund and you want peace of mind for any major expenses, hospitalizations, things like that, or you have a chronic condition that you need to monitor, then it's worth considering and looking into. Like I said, I personally don't have health insurance. I just pay cash as I go, and luckily I'm healthy and I don't get sick. But my annual healthcare costs here have been less than what it would have cost me for 1 month of insurance premiums like I was paying back in the US. Okay, so some of you may find this topic a bit morbid, but it is important, and a subscriber specifically asked about this scenario. What happens if you die in the Philippines as an expat? What are the various options, and what are the costs of a funeral, burial, cremation, services, etc., and compared to the U.S. So in the U.S., a typical funeral is going to cost you, for just a traditional burial, the funeral service alone is going to cost you $2,000 to $4,000. The casket will run you $2,000 to $10,000, depending on how elaborate you get. The embalming is going to cost you maybe $500 to $800, and then the burial plot itself is going to cost you $1,000 to $4,000. Headstone is going to be another $1,000 to $3,000, and then the cemetery fees are maybe $500 to $1,500. So your total is going to average you $7,000 to $12,000, and it can actually go much higher. Now, if you want to be cremated, a cremation service is going to run you $1,000 to $3,000. The urn will cost you $100 to $500, and a memorial service, which is optional, will run you maybe $1,000 to $3,000. So your total average cost is going to run you about $2,000 to $5,000. Here in the Philippines, funeral cost, for a traditional burial, the service itself will cost you 30 to 80,000 pesos, which is about $550 to $1,500. The casket, maybe 20 to 100,000 pesos, again, depending on how elaborate you're going to get, and also on the quality. The embalming is going to cost you maybe 5,000 to 15,000 pesos, which is $90 to $275. The burial plot itself, maybe 20 to 100,000 pesos. which is about $360, $1,800, and it depends on the location and the type of the cemetery, etc. The headstone will cost you maybe another 10 to 50,000 pesos, which is $180 to $900. So your total average cost is going to run you maybe 100 to 250,000 pesos, which is about $1,800 to $4,500. Now, if you want to be cremated, a cremation service will run you 15 to 40,000, which is about $275 to $750. The urn, another 2 to 10,000 pesos, and then the memorial service, which is optional, will run you another 10 to 30,000 pesos. So your total average cost is going to run you maybe 30 to 70,000 pesos, which is about $550 to $1,250. So even death is cheaper in the Philippines, and roughly 50 to 60% less than what it costs in the U.S. Now, there are some important considerations for expats that you want to think about. So, you have options. Your first option is you can be buried here in the Philippines. It's cheaper, and you're allowed to be buried in a Philippine cemetery. And some expats actually choose this, if they've decided to make here the Philippines their permanent home, or if you have a spouse. Your second option is you can opt for repatriation, which is where they send the body back to the U.S. They're going to charge you embalming and preparing the body, which will cost you maybe 20 to 40,000 pesos. Plus, then you're also going to have international shipping charges of the body, which is going to run you maybe another $3,000 to $7,000. And then you still have the cost for the funeral back in the U.S. So your total is going to still run you $10,000 to $20,000 or more, which is really expensive. And you have your third option is you can be cremated here in the Philippines, and have your ashes sent home. Cremation here in the Philippines, maybe 15 to 40,000 pesos, like I said before, which is $270 to $750. The shipping your ashes back will be maybe $100 to $300, which is much more affordable because your total is maybe $500 to $1,000 or dollars. Yes. My recommendation though is talk to your family about it. Tell them what your wishes are and what your plans are. If you plan to stay here in the Philippines long term, maybe cremation here with your ashes sent home is the most practical and most affordable option. Again, unless you have a spouse here, then obviously you need to talk to her and consider her wishes as well. And in addition to your family, some expats, they also have a pre-plan and they prepay for funeral services here. It locks in the cost and it relieves the family of any burden that they may have, once you pass away. Well, there you have it. Healthcare in the Philippines versus healthcare in the U.S. It's literally like night and day. In the U.S., you pay thousands of dollars in premiums. You wait weeks, sometimes months for appointments. You have to deal with insurance bureaucracy and nonsense. Sometimes you have to wait for an insurance company to actually approve a procedure or a medication that the doctor is saying that you actually need. And you still end up with massive bills, even if you have insurance. Here in the Philippines, you walk in, you get seen almost immediately. Sometimes you have to wait, but most of the time it's great. You receive quality care and you pay a fraction of the cost. My dental emergency was $160 compared to $2,000 to $4,000 in the US. And my serious illness with the full workup was $340 versus $8,000 to $15,000 in the US. And this is one of the biggest quality of life improvements that I've experienced since moving here. Healthcare is accessible, it's affordable, and for most common issues, the quality was excellent. If you're considering moving to the Philippines, don't let the healthcare concerns, hold you back. You'll be fine here. It's actually one of the best reasons to actually move here. Unless, of course, you have, serious health issues or, like I said, a chronic, concern or disease or something like that. However, I've actually had people tell me that because of the amazing quality of life they have just by living here, their health actually improves significantly just by living here. Well, that's all I got for you today. What about you? Have you had any healthcare experiences here in the Philippines? Drop a comment. I would love to hear about it. How did your experience compare here versus, back home in your home country? Drop a story in the comment. I'd love to hear about it. And again, if you found this video helpful or informative, smash that like button and subscribe for more real life Filipino content. And again, thanks for watching, and I will see you in the next one. Salamat!